Since gaining independence, the DRC has faced numerous development challenges, including immense poverty, high levels of violence, entrenched corruption, and low standards of health. The conflict began due to a complex variety of reasons, from hostility over basic resources such as water to control over the vast mineral wealth in the DRC, as well as other political agendas. The recent conflict between the DRC and neighboring African countries claimed the lives of approximately 3 million civilians and has been termed Africa's World War. In the aftermath of the conflict, the infrastructure of the DRC, both physical and administrative, has been severely damaged, and the DRC ranks last on the HDI scale.
Our program focuses on two key issues facing the DRC, health and safety. By addressing these two areas, we believe we will not only improve health and safety outcomes, but also stimulate the economy and improve prosperity and well-being overall. Prior to the conflict, the DRC used a health system known as the health zone system, which divided the country into zones of 110,000 people, with each zone being responsible for primary health care and referrals. This system, while severely damaged, still exists, and our health program is aimed at reconstructing it and providing the DRC with necessary physical and human infrastructure to support the health system. The security portion of our program will focus on mitigating the damaging effects of instability caused by the conflict by ensuring basic human security for the people of the DRC. Overall, 70% of our funds will be spent on health, with 20% going to our two personnel training programs, 30% towards the Health Zones project, which involves reconstructing the overall health system through physical infrastructure and disease control and basic health programs, and 20% towards rebuilding additional physical infrastructure such as roads and sanitation facilities. The remaining 30% will go towards our safety programs to ensure the security of these health reforms and DRC citizens in general.
We will implement a sustainable physician and medical technician training program and a community health worker training program with a focus on maternal health. The goal of these training programs is to increase the doctor-to-patient ratio and support overall health reform. Currently, there are only 10 doctors for every 10,000 people in the DRC. There will be a core of students who will learn teaching pedagogy so they can remain at the training facilities and eventually replace the partner doctors as the training staff. Scholarships will be available to cover transportation, housing, and food costs. Female participants and participants from rural backgrounds who commit to working in their home regions will be given priority for these scholarships to ensure that the benefits of the program spread evenly across gender and urban versus rural areas.
As the lowest ranked country on the HDI scale, the DRC has some of the poorest health metrics in the world, including a maternal mortality rate more than double the global average. These poor health outcomes are due to the destruction of the health system during the conflict, as well as the fact that minimal government investment in health expenditures has caused the majority of the cost to be placed on individuals who often cannot afford these health services.
Over the course of recent conflicts, nearly half of the infrastructure in the DRC has been destroyed. Only 2% of roads are paved, and less than a third of the population has access to proper sanitation facilities. Proper infrastructure is essential to improving health outcomes. Improving roads will ensure that people are able to access the healthcare services and connect the country as a whole.
The implementation of a strict safety reform program throughout the Congo will not only prevent the outbreak of future war, but also increase economic development, reduce poverty rates, and promote peace building and democratization. We will be doing this in 2 steps. The first step will compose of improving human security and basic law and order. Building stable prisons and police stations, as well as developing the legal education sector, will be critical in decreasing crime rates and increasing criminal convictions. We will introduce balanced ethnic and confessional benches during trial in order to prevent judicial bias and ethnic favoritism. Recruiting and training local judges will not be enough to ensure legal fairness. Therefore, we will deploy United Nations police as well as international judges. The second step in our safety reform plan will be to employ predictable and effective government by eliminating 2 major factors which have plagued the development in the DRC: corruption and the exploitation of.
In conclusion, by improving the health sector and safety of the DRC, improvements in the economy will follow. Improving these 2 areas will have ripple effects for the country as a whole and lead to positive change and increase stability and eliminate conflict. Without a healthy population, the country will not be able to move forward, and without a safe environment, the country will continue to fall victim to civil war and unrest. We have based our plans on past plans that have had success in other developing countries. We chose not to use our money for general economic aid because oftentimes in the past doing so has fallen short. Specifically in the DRC, focus on mineral wealth has left majority of the population in poverty and done little to eliminate the problems the country faces.